Hi guys, and welcome to lowerbackpainfix.com. So what we're going to do in this initial video is just give you some tips that help get you mobile, because if you're anything like me, you've probably searched on the internet when you're already in trouble and you've got some pain in your lower back. So what we'll do is I'll go through some basic exercises that help get you mobile and needs to get you upright. They're not an ideal long-term solution, but they will take some of the pressure off your lower back. Like I say, just get you upright when you're really in trouble, literally having trouble getting out of a chair or you're stuck in bed. Okay, so what I found from my own experience in my own back and my back of my clients is that when I've got a lot of lower back tension, usually the muscles along the front of my thighs, my hip flexor muscles, are very tight and balled up. So I know that if I can release at least some of the pressure for these, it will take some of the pressure off my lower back so I can get upright and be relatively pain-free. Doesn't mean it's going to be 100% pain-free and totally fixed, but at least it will get me mobile on the days when I'm definitely in trouble. So what we'll do is I'll give you three options to try and stretch your hip flexors out, and it's a choice for you then to just choose or try all three of them and see which ones you get on with best when your back is bad, and that way then you've got a strategy to get you out of trouble in your really bad days. Okay, so the first one, which works for me if I'm really bad and I literally can't get out of bed because I've done my back in some heavy deadlifts or something like that, is that on the floor or in the bed, if you're literally still in bed, very carefully, I'm going to prop myself up on my elbow, be careful not to put a bend in my back or drop my hips too much, and then from there I'm just going to lean back, get myself propped up, and then very carefully grab hold of this leg, and I'm just going to pull my heel up in towards my glutes, up in towards my bum, and you should get a little stretch in here, and then from there you just want to hold that stretch as hard as you can, 15 to 30 seconds or so. Let it relax off, and then you come back in again. Should be get a little bit more of a stretch this time to ease us off. And again, give myself supported stretch. And once I do about 4 or 5 times on one side and feel it loosen off a little bit, swap to the other side. It's exactly the same. Keep yourself propped up, and then just be careful. Pull your heel up towards your glutes, and then try and feel that stretch just in there. But you've got to keep yourself propped up in your elbow, because if you suddenly jar your back, it'll spasm again, so be real careful on this one. But if you're stuck in bed and you can't get out, this will definitely get you up and mobile. So about 4 to 5 times on each side, just take some of the pressure off, and then you can go on to the next stretch, which I'm going to show you. Okay, so the next stretch we're going to go for is a supported stretch. Should let you open up your hips a little bit more and take some pressure off. So if you can get yourself into this position where you're supported with a table, and the leg on the same side as the leg we're going to be stretching. So from there, keep yourself supported, no pressure on your back. What I'm going to do is I'm going to push my hips down like a 45 degree towards the floor, and just get a nice stretch in that rear leg. And if you can at the same time, just gently squeeze your glute, and that'll help pull your pelvis back and just heighten the stretch. So again, do about 15 to 30 seconds or so. And then do the other side, and then come back to this side, and again 15 to 30 seconds, and just try and get a little bit further each time, and just try and take some of that pressure off your lower back. But again, keep yourself supported, and make sure your back doesn't start to spasm. Okay, so the third choice we've got, which is a little bit more advanced, so it depends on how flexible you are and how balled up these are. If you can go from the table supported one to this one, you'll take off loads of pressure with this one. So what we're going to do, we're going to lift our foot up behind us, and it's going to really stretch out your hip flexors and your quad muscles. And then from there, nice and upright, again we can lean forward, drive a hip in towards the floor, so we'll stretch more of the hip flexors here. And if you want, you can change the stretch on this one slightly. You can come back a bit more into your bum, and really lean up. Try and tense your glutes here, and you'll feel it more on these quad muscles. So I'd say have a go at both and just see where you're tightest. And again, 15 to 30 seconds in each one. Then change over. Same on the other side. Again, just feel where you're tightest. And adjust 15 to 30 seconds. Get a nice stretch and make sure you can loosen these up. So the looser these are, less strain is going to be on your lower back. So although this won't probably fix the problem long term, this only takes some of the pressure off for you, and takes some of the pressure off your lower back, and it'll get you up and mobile without having to take any painkillers or do anything else. So when your back's really, really bad, just go through those 3 progressions of stretches, or pick the one that's most effective for you. And I would recommend that throughout the day you keep doing them and keep trying to get these muscles to loosen up. Okay, so that was kind of 3 of the most beneficial strategies I've found that work for both me and my clients on days when your back's really, really bad. Definitely just from sitting down too much during the day, these muscles tend to tighten up anyway, but I definitely found from my experience that when I've really damaged my back, these muscles seem to ball up even more. So it might be some sort of defence mechanism to try and stop you from extending your back, because your body thinks you're going to damage your lower back maybe. But I've definitely found that when my back's really bad, I loosen these up, my pelvis will come up to where it needs to sit, and it will take a lot of pressure off my back because it's not constantly pulling me forward all the time. So those things, they're not really like designed to fix the problem, manage the problem long term, but they'll definitely help you get mobile. So then in the actual program that we go through, again with videos, if I talk about strategies that you'll use, it'll actually use to help fix the problem long term and help manage your pain, and hopefully reduce it as well. And definitely on days when your back is really, really bad, I would avoid sitting as much as possible, because I know from my own experience that I can get it mobile by doing those stretches, but as soon as I sit for any prolonged period of time, everything will just ball up tight and I'll be stuck again. So as much as you can, try and kneel, and then during the day as well, just keep stretching it out. And if you need to pick stuff up, try and lunge down and pick stuff up rather than trying to bend your back. And again, that'll just loosen some of the pressure off.